Hello, welcome to the Voyage Clinics podcast. Dr. John here, family doctor. Just our objective with the Voyage Clinics podcast is just to educate the community and bring knowledge to everybody out there. And so hopefully this will help us. Today we got a great guest, Matt Quackenbush. Just wanted to talk to you a little bit about your background and kind of share your story. So give us a brief introduction about who you are, where your journey is, what it's like, and let's go from there.
Well, thanks for having me on, man. I'm stoked to be here, dude. I love doing podcasts. I've been in the podcast game for 6-7 years now, man. Cool. I've been doing it. So my story starts way back in 1983 in Orem, Utah. My parents were here students. My mom and dad had me, and then we moved to San Diego, California. And I grew up there, lived there my entire childhood, had kind of a wild childhood, bunch of hoodlum stuff, running around, running and gunning, and decided to up and change my scenery and moved up here to Utah to get some schooling in. And I've been in the mental health field for about 20 years. And for about half that time, I've been a licensed clinician working primarily with, as like a trauma therapist is kind of what I call it, using like trauma-focused modalities and using that as like a framework to be able to do healing. And it's really become now, it's morphed into like a holistic framework of using even like, non-traditional mental health interventions like, exercise as
super weird,
as a primary intervention for mental health recovery. And so it's kind of morphed into this, I don't know, Megazord, to use a Power Rangers reference. Megazord of different arms to my company called Finding Strength.
Cool.
And so we have the podcast, and I do public speaking and education, and I work with a company and co-own a company called Deer Hollow Recovery, where I've worked there for about the last 8 years in the recovery space, doing a lot of mental health stuff with first responders and veterans and substance abuse. I've worked in substance abuse for almost 20 years now. Yeah. And, I've worked with Cirque Lodge. I've worked with, where else? I've been all over the place, man. So wow. I get around.
Cool.
And, it's been quite the journey to get to where I'm at now and really have this comprehensive approach to treating mental health.
Yeah.
And really overall health and understanding like the health of the human being. It's kind of how I see it. Like I'm not really treating mental health. Like we'll treat like brain health if you want to target the brain. We'll treat psychological health if you want to target the psychology, like the thinking, right? But what we're really trying to do is just heal the human being, because that's, just hearing your story about how Voyage Clinics got started, it's pretty cool. The model, you're trying to switch it up. The healthcare system, it's got some very serious fractures, and we need innovators to come in and be bold and ruffle some feathers and create some change. So I'm glad we could sit down and talk shop here for a minute.
Yeah, for sure.
It's freaking awesome.
So cool. I love what you said about just taking comprehensive care of people and trying to help them find healing and health. That's really resonates with our core values at the Voyage Clinics as well. We've got a health coach program, a sleep coach program. I'm a family doctor, and we're very trying to address all the aspects of people's health. And over my career as a family doc, taking care of people, I've delivered babies, worked in the ER, worked in hospice. I've done everything from the beginning to the end of life care. And I learn more and more about how important emotional work is, and mental health and emotional intelligence, and how can we enhance that and improve that. And so I love your journey. Thanks for sharing a little bit there. I'm sure you've got cool stories. I'd love to hear some of that. I want to hear what brought you toward the mental wellness space. Like what was it that gravitated you towards that? And I want you to talk a little bit about your PhD as well.
Sure. The thing that brought me to mental health it actually was almost accidental, but not quite. Like I've always had like an affinity for working with the less fortunate, I guess. I don't know if that's really the way to say it. Like the example I give is like when I was a kid in elementary school, they tell these stories of where I had all sorts of different friends. but I like to chill with like the kids in the wheelchairs and the kids who are like special needs and like help them eat lunch and like try and bring them out and play basketball with them and stuff. That was just kind of like my nature, even as like a little kiddo, you know? And so that's kind of just, that's a big part of who I am. And seeing people and really like, you know, gaps that need to be filled, areas that I have identified or colleagues have identified of places that need attention that are just being missed, you know? And that has become more or less like an obsession, especially now that I work with a lot of first responders and veterans who are a very underserved population, extremely unwell, very, very sick. And they are now not as much the fire guys and really not as much the veterans, but especially the law enforcement officers, man. They have just been brutalized in the media and even pop culture. I mean, it's just, it's tragic to watch these incredible human beings who've dedicated their life to serving and helping be just destroyed. And their rates of suicide and depression and all this stuff is just through the freaking roof. And so that's become a big part of what I do. And that's why I went back to school. My PhD research is around law enforcement and first responders and veterans and the gaps in care, the kind of the spaces that need to be filled in the research. So it's a research degree. And I'm working on understanding. There's kind of two specific areas that I really like to focus on, and that's sleep wellness. I'm a big fan of sleep wellness and understanding like the integral piece that sleep is in health, overall health, especially mental health.
We have a sleep coach program.
You're saying that, which is super freaking cool.
Yeah,
and that doesn't happen very often. I do a lot of sleep work, sleep training.
Let's nerd out about that sometime.
Yeah. I just got done. I was out in Oregon, in Albany, Oregon, with the police department out there for 4 days doing an intensive sleep workshop.
Wow.
Yeah, it was really fun.
That's
a blast. Just trying to help them, like anything we can do to help these guys, like not be so pissed off all the time. You know, that's a big problem. Anyways, but yeah, that's a lot of what my PhD research stuff is working with, looking in the academic world and trying to find what little information there is. Cause it's really it's kind of fun. I'm like on the advent of this new thing we're researching in academia about, you know, first responders and mental health. It's really fresh and fun. And there's a lot of new stuff coming out about it. So it's kind of hot. So really, when I first started my PhD a couple of years ago, there wasn't much. And now there's tons more than there used to be, which is really fun.
That's really cool.
Yeah.
What a great subset of group of folks to work with. I have friends who are, you know, police officers, highway patrolmen, firefighters and things, and first responders, paramedics, all of that. And the degree of trauma that they experience is substantial. The things they see, like one of my colleagues was like, it's almost too hard to even talk about. Like it was just really, really traumatic. And he was like shaken to the core and didn't sleep and still struggles with it, right? Like still struggles with it. And so I love that you're doing work in that space. It's much needed. I don't know what happens in medicine. Like there is something there. We definitely see a lot of trauma. There's like, I remember like my trauma surgery rotations and stuff like that. Like there's like you see gunshot wounds, like knives sticking out of people and, you know, lots and lots of really bad things. And I don't know, somehow we get through that. And I don't know, I don't want to say we get numb to it, but we get accustomed to it because we see so much of it that it doesn't, I'm sure there are still doctors that struggle, but sure. But like for the most part, at least trauma surgeons walk around and they have seen the top shelf stuff, like full body burns that are, you know, really, really tough and really tough kid stuff. And,
gory. And that kid stuff sticks with you.
Kid stuff's tough. Yeah. But it's amazing and it's beautiful work. So thank you for what you're doing in that space. Well, that's super cool.
And you know, John, the thing that we've found in working with first responders, especially as, you know, Deer Hollow became like the premier treatment center in the country for these guys. What we've really found, and the research is leading in this direction too, is that have you heard of Gabor Mate? So he wrote a book called I can't remember the name of it off the top of my head, but he's written several books. He's an absolutely incredible MD. And his basis for doing addiction treatment, he's out of Canada, is childhood trauma. So he used a lot of stuff like the ACEs, Adverse Childhood Experiences scores, to understand the roots to addiction. And we've kind of applied that as well to working with first responders. And one of the things, book Chasing the Scream, I knew it would come to me. Chasing the Scream, amazing book.
Okay.
Incredible. You should definitely read that.
Okay.
It's phenomenal. Like game changer stuff. What we found is that, I'll back up. He talks about veterans who come home from war and how there's about 20% of these veterans that develop complex PTSD, severe post-traumatic stress. And he claims, and he supports his claims with a lot of evidence and research, that is due to their developmental upbringing. And it's the childhood that is the indicator for the development of post-traumatic stress disorder in the long term. And we've taken that at your hall and in my private practice as well, as I work with, I work with a lot of people with severe sexual trauma and physical trauma and stuff from childhood. And working on that is what does the healing. So we get guys and gals who come into the treatment center and they'll want to talk about the calls and they'll want to talk about all the horrible stuff. And we're like, cool, let's put it down. Let's write it down. But we're actually going to go way back. Let's talk about what happened when you were a little kiddo. And 999 times out of 1,000, they were sexually abused or physically abused or neglected or were impoverished. And when you dive into the research on childhood trauma and you look at the ACEs scores and the actual adverse childhood experiences and the categorization of these, what you find is that there's actually 4 traumatic experiences that seem to have a compounding effect that outweighs the other adverse childhood experiences. And those are sexual abuse, physical abuse, neglect, severe neglect and abandonment, and poverty. And when those 4 childhood experiences combine with one another, the actual compounding effect is not quite exponential, but almost. So it's very interesting to look at what's going on, physically, emotionally, psychologically for these little tiny kiddos who then grow up into adults and maintain the same neurological structures and maintain the same emotional coping mechanisms that they developed in childhood when they were being beaten or abused or neglected or impoverished.
Wow.
Wild, right?
Yeah. I want to put a pin in trauma because I want to circle back to this.
Please.
I want to talk a little bit. Wow. That's amazing. I want to hear more about that stuff too.
I'll go all day, man.
Yeah. Super fascinating. I want to talk about like therapy. Last week I did a podcast on, I'm a family doc, and how do you get the most out of your doctor visit, right? So whether it's a family doc or an internal medicine doc or a specialist or a cardiologist or an endocrinologist, how do you get the most out of that encounter? And so I want to just talk briefly about therapy. Like going in, I want to get help. I want to do some emotional intelligence work. I have an addiction. I struggle with this thing. Maybe it's a substance abuse disorder. How do you go into therapy and in a productive way? Mentally, how do you talk through things and how do you, because I find therapy is a mixed bag. Sometimes I send folks to a therapist and it's like awesome results. And sometimes the therapist and I'm like, wow, like it's not, it's like worse than when I sent you. And so it's tough. Yeah. And so I'd love to hear your thoughts on like, how do I as a person seeking emotional intelligence work, whether it's addiction, et cetera, how do I get the most out of my therapy?
Don't ruminate with your therapist. If your therapist leads you down a path of just talking about your problems in a ruminative pattern, that might reinforce some old negative thinking patterns and you're going to get worse before you get better.
Explain the rumination piece.
Ruminating is the process of getting stuck on your thinking and using thinking to solve your thinking problems. Does that make sense?
Yep.
And
thinking more, to think some more and think more. And we're all in this thinky space.
I'm going to go into therapy and I'm going to sit down with a therapist, and the therapist is going to tell me about my thinking, and we're going to think about my thinking. That's not going to solve anything. It's just going to create neurological patterns that are more deeply ingrained because I'm going to reinforce my thinking. It would be nice if we could do that, but that's not how it works. We have to use like somatic interventions, body-based interventions. And this is why one of the things that I harp on with clinicians, because I work with tons of clinicians and I train a lot of clinicians, and I, there's this book out now, I think it's called like Bad Therapy. We're under the microscope, folks, and we should be. Clinicians should be under the microscope. Mental health clinicians should be under the microscope. The training we receive in school, I'm not going to say it's inadequate, but I'm saying it lacks the thoroughness that is needed in order to provide the adequate care that people really need. And most of the work that is being done by good therapists, they've learned through specializing in specific treatment models and modalities. And so when people ask me this, how do I find a good therapist or how do I get the best thing out of therapy? First thing you sit down in therapy and you say, what model are you going to use? What modalities are you using with me? I want to make sure that you know your stuff and that you're trained into your stuff. And that those modalities are, I guess, not just evidence-based, but have been shown to work based off of the issue that you are thinking that I have.
Yeah.
Right?
Appropriately applied.
Correct. And Docs, you guys are really good at this, right?
Well,
That's what you have to do.
I need to know. Yeah, I'm good at that in my space, but like in the mental health space, I don't know what mental health modality is best for XYZ. Right. I know that dialectical behavioral therapy is good for borderline personality disorder. Sure. I know that. I know cognitive behavioral therapy is sometimes okay, but that's can lead to rumination, right? Because you're like,
how many cognitive behavioral therapies are there? There's trauma focused. There's this. There's mindfulness based. Yeah.
So I don't always know what to recommend as I send someone to therapy. I just send them to therapy and hope that the therapist is competent enough to ask a few questions. Right. I'll send them a diagnosis. I'll say, hey, this is what's going on. They got bad trauma and anxiety. And then the therapist can, and I always just write eval and treat. I don't say, please use this type of therapy. Blah, blah,
that's
blah.
Not really your wheelhouse.
It's not my wheelhouse. It's not really my job. Like it's your job. You get to figure that out and you get to apply your skill set to this equation as long as it's appropriate. So maybe I need to know better how to refer to people and maybe suggest like, hey, sending person to therapy, sent one today to therapy. She has severe anxiety, bad trauma. She has like some really bad stuff. So I send her to therapy and I just give them a little history. Like here's the little tidbit about it. And then I just put eval and treat. But if I knew more about the modalities and where their applications are, I don't know if that would be helpful or not. But you're saying like even as a client, as a person doing your research and saying, hey, I'd like to try this modality. I'd like to try this modality as just a self-advocate.
Sure. And an easy thing to do. So you got a couple of like models that are really, modalities, we should say, that are really effective and popular. DBT comes up early on, but it's a behavioral model, right? So it's modifying people's behavior, and that's why it works with borderline. But so my model of preference is internal family systems, coupled with eye movement desensitization reprocessing, EMDR. A lot of people know EMDR. There's one that's come on in the scene in the last several years called accelerated resolution therapy, or ART, which uses some of the same techniques as EMDR. Great results with that. I'm not trained in that one, but I know a lot of people who are, and they get really awesome results, and I hear a lot of good feedback from that one. Cognitive processing therapy is one that is really challenging to use, and to have a therapist be good at it, I've found is kind of challenging. But when a therapist is good at CPT, cognitive processing therapy, it can be incredible. That one requires a ton of homework. And it's literally like you're going to a college course and you have to do this homework and bring it. And that's why it's kind of like this barrier, because that's just not something everybody's going to do. Right. So it's kind of the right person. And then you have, your traditional cognitive behavioral therapy, which really is, and I don't want to be too outspoken here, But if take this with a grain of salt, folks. If your therapist says they use cognitive behavioral therapy, like, no duh.
Yeah.
We all do.
Yeah.
That's not a modality. That's a category of specific modalities that's been around for a long time, right? You got these incredible, mind-blowing researcher, innovator guys who came up with this idea for cognitive behavioral therapy. And then after that, this is, 20, 30, 40 years ago. And now we have way more knowledge. We have way more information. At the time when CBT was being created, which we didn't even have things like an fMRI to really understand the neurology of what's really going on. So we're focused so much on the behavior that's the thing that we're trying to correct, when in reality, the reason I behave the way I behave is because of the way my brain is functioning. The reason the way my brain is functioning is because of how I experience things, because my experience creates my neurological pathways. So that's why this trauma-focused thing now is such a buzzword, because really we're looking at the experiences you go through as these pivotal moments in life that become the creators for your neurological structure, your scaffolding, essentially your belief systems, which is what cognitive behavioral therapy discovered in the beginning. How you believe and what you perceive creates your behavior. And there's a lot of really good models out there that are excellent at finding that out very, very quickly and attaching that to early memories and re-evaluating the belief systems that have been established in relation to those early memories.
Oh, cool.
And that's what EMDR does. That's what why EMDR is so popular. I'm also a huge fan of mind-body bridging. I'm a certified mind-body bridging therapist. It's kind of like a Utah homegrown model that a lot of therapists around here, not a lot, that several therapists around here use. And most mind-body bridging therapists are quite well versed in what they're doing. Anyways, I could go all day about treatment models, but I would, if I was going to therapy, that would be the thing that I would ask.
I'm going to take you to lunch and we're going to nerd out about treatment models, because it's something that I need to understand better so I can better suggest things. I don't mind suggesting,
sure,
hey, maybe consider this and this, and they're going to look at me and say, no, duh, Dr. John, I'm this therapist, you're not. Don't.
Right.
Like, I love it when therapists refer to, they put a note to me and they say, hey, we suggest this medicine. I'm like, that's my space, dog. I do that all the time.
Yeah.
I know this stuff.
Yeah.
but I don't mind. I'm never offended.
Sure.
But let's talk a little bit. We got a little derailed. The thought process is like, how do we make the best of our therapy?
Sure.
Don't ruminate. Don't spend all the time thinking about your thinking. And then the other one was have an understanding of like who you're talking to and what their specialty modalities are, and if those modalities are appropriate to help you in your situation. And maybe just a conversation. Hey, do you feel like your wheelhouse can handle like what I'm bringing to your equation? And if not, it's no big deal, no harm, no foul. But I'd like to get really good therapy. And if you're not comfortable, that's okay. Let's just move through this thing. What's another way? Like how do I go to a therapist with an open heart and an open mind, such that I am productive? Like me as a person, like I've got the right mindset, I've got the right heart set. If that's a thing, it's probably not a thing. But,
yeah, definitely. No, I know exactly what you're talking about.
But how do I make the most of my therapy, like as a personal person? Like,
I think what's hard about life in general is that we take things really personally. And I think that therapy is not meant to be taken personally, which seems oxymoronic.
Because it's very personal.
It's very personal.
It's very vulnerable.
It's super vulnerable.
Yeah.
But if you go in with like the heart set and the mindset of like just being open and curious rather than guarded and judgmental, and notice when you become guarded, when you become judgmental, and see if you can use your therapist to find the patterns of when that shows up. And that'll show up physiologically in the body, right? It'll show up through heart rate increases. You'll get hot, you'll get tense. If you can notice the patterns around those things, you can change the patterns around those things.
Cool.
I think that would probably be a really good way to answer the question.
So stay open, be curious. We say heart set and mindset, and it is like maybe not being so set.
Correct.
Being willing to have some flexibility around the possibility that the way I'm thinking is maybe not the most effective way of thinking, or maybe I'm wrong. Maybe I'm not correct in the way that I'm viewing myself, the world, other people. So just kind of stay open.
Yeah. And understand that like, we're here to learn. We're here to grow. We're here to understand that we don't know like anything. And you don't even know what you don't know.
Yeah. And
I've done a lot of grief work too. I've worked with families who've lost children for like the last 8 years. Our best friend's daughter died. And I kind of got launched into this, working with this really cool organization called Brighten a Day, and worked with, dozens and dozens of families and helping them through the grief process. And I think it applies here because when you learn about, they have the 5 stages of grief, when you learn that that's not at all linear and it's cyclical, you begin to understand that I can't change what's happening. I can only change my response to what's happening. And what I'm trying to examine in therapy is my response to what's happening. Mm. And if I just think about my response to what's happening, I'm never going to notice that my response to what's happening is my thinking. Mm. And I can't just change my thinking by thinking. I have to change my thinking by feeling how it feels to think the way that I think. Yeah.
That's heavy, but really cool.
Because it's beautiful, and that's what creates this change. And it's heartfelt. Yeah. It's the heart that's doing the change. Yeah. It's not the head.
Yeah. I've had conversations with folks where it is so heady.
Yeah.
And then there's something that happens, and I can't explain it because I don't do a ton of this work, but like the conversation goes to here. Yeah. And it goes to the heart, and you're vulnerable, you're open, there's a sharing. And I've had these with my wife, these discussions where we were way too heady about it. Mm-hmm. And then it moved to another space, and we both felt that. And I don't know, how do you get there? Like, how do you consistently, I read a book called The Ant and the Elephant. It's great. It talks about ant is your frontal cortex thinker guy, and elephant's kind of the lumbering emotional centers. And it's mostly for business people. It's an interesting book. It's a small little baby read, but it's a good analogy. The ant is just riding atop the elephant, and sometimes overbearing, right? And so then the elephant is just like, sometimes they're at opposition to each other. And to put those two in line is really helpful, and even to allow the elephant to lead more and quiet the ant and get good at the ant just directing traffic occasionally, but the elephant's really leading. But most of us lead with the ant because we're very we're a left brain dominant society. We just very much are. And so we're in this, especially in the doctoring space, right? I was talking to my medical student. I teach a couple different medical schools, and I was talking to him today about the art of caring for people. And
so beautiful.
And how it is very much right-brained, and you get to feel, and there's intuition in the room. It's not just science and diagnosing, and here's a medicine, pharmacology, anatomy, physiology. All of those ologies are beautiful, good knowledge, but there's an art there that has to, and it's that, I don't know how to get there, but it's that other space that you can connect with people and really feel and really help people in that space.
It's spiritualology.
Yeah. Yeah.
Are we allowed to talk about that in medicine? I don't know.
I don't know. I use it all the time. I love it, man.
Did you make up that word? That's a cool word.
Yeah. Well, you said the ologies. So I was like, spiritualology. I've never said that before. Well, it's quoted here, Voyage Clinics.
Yeah. New book. Let's write a book.
Spiritualology. Well, it's this thing, man. There's this stuff that you just can't measure. And we try to measure it. And we got this whole thing called quantum mechanics now that's trying to figure all this crap out that we, that these quantum molecules don't behave until we look at them and then they behave. What's that all about? Right? Like, that's bizarre, but that's a thing, and we can measure this now. So what's going on? And I think that that's the coolest part. That's why it's curiosity. It's like, what's happening? This is kind of fun. Like, let's think about the worst moment of your life. That might not be fun, but let's just feel it for a second and watch what happens when you feel it. Instead of thinking about it, Instead of trying to figure out why it happened or how you can change it or what you can do about it, just feel that crap for 5 seconds, 10 seconds, and watch what happens. And every single time they go, wow, it's changing. It's not the same. It's moving. It's flowing. And when you understand that you have this capacity to embrace that flow or reject it, and the more you reject that flow, the more you suffer, you begin to quickly realize that this flow thing that you're trying to understand, that you're trying to figure out, is really just this thing that in the East they call the feeling. Mm. And we call it anxiety here, but it really is just the feeling of being not dead, because that feeling goes away when you die. And up until that point, you're going to have this feeling. Mm. And that feeling is also the thing that connects you to other feeling people. Mm. And if you can embrace that and enjoy it and get curious with it, your whole life changes because you connect to the feeling. And maybe that's God. Maybe that's love. Maybe that's the Great Spirit. Maybe that's, who knows? But one thing is certain, since the beginning of our ability to write stuff down, we've been talking about this thing called the feeling. Mm. And it needs to be talked about more. It needs to be felt more. It needs to be experienced more. And I think the more we embrace it, the more we learn to love and connect with one another. And the sooner we're going to stop being so freaking pissed off about our little petty differences.
Yeah. Yeah. I love your shirt. We is greater than me. Yeah. And that speaks to what we're talking about now with that connection and that vulnerability together and that feeling and just being and holding space. I think we get so heady, right? We get so frontal cortexy, and it kills that feeling. And it goes away for a bit, and then because we're so smart, and then
I'll figure it out, man.
Because all the ologies,
yeah.
and then we got to pull back to that space. And I think this is super cool.
Thanks.
Would emotional intelligence work? I don't know. I grew up in a small town, Nevada, and
which town?
Round Mountain. It's a little mining town.
Okay.
Yeah, it's like
I know Nevada a little bit, so I was curious.
Yeah, 250 miles from anything.
That's kind of
the
cool.
nearest Walmart is like a 5-hour drive. So I grew up in a small town, but then it was too big for my dad, so we moved 20 miles down the valley on a little parcel of land, and we had animals and stuff, and I'd ride a bus into school, and it was a good little drive, and I'd look at the mountains, and I'm just thinking, pondering the universe, and not a lot of talking because I'm like one of 2 kids on the bus, and we've already said everything there is to say, and so I just learned to be still and to see and to feel and to breathe, and I don't know. I think emotional intelligence work for me is like, it's like every day. It's like just breathing. And I wonder if we all wouldn't benefit from emotional intelligence work in all of its flavors. Therapy, yes. But maybe there's podcasts out there that are really good. Maybe there's just meditation and mindfulness and all kinds of emotional intelligence work. What are your favorite kinds of emotional intelligence work for maybe a self-help person they're just like looking to improve their emotional intelligence? I get angry really quick. I'd like to not do that anymore. Like, are there tips and tricks for them, or do you think, well, let's move towards therapy? I think it's better guided. What are your thoughts there?
I think one of the best places that you could ever do emotional intelligence work, is on the inside. Mm. And it will never, just realizing that it will never happen on the outside of you.
Tell me what you mean.
No person, no scenario, no circumstance is ever going to be the correct one for you to do inner work if your inner working parts, if your inner working desire isn't ready for it. Mm. And so
you can't force someone to do emotional intelligence work, and nor can you really force yourself to do it.
And so whether you choose to go to therapy or whether you choose to go to a workshop or whether you choose to read really cool books, like my all-time favorite books is Inner Engineering, Sadhguru. Unbelievable.
Okay.
Just mind-blowing, dude. This guy is like, in India, they raised, he's a yogi, and they raised these like spiritually connected little kiddos to become gurus for their entire life. So that's all he's ever done. That's all he knows. Wild stuff. But it's called Inner Engineering, and he just talks about every experience you ever have happens on the inside. And so when you go in to do emotional intelligence work, you're doing heart work. And whether that's across from a trained therapist, clinician person, or a coach, or a friend, or you're going to connect in some sort of like social setting, like that can all be emotional intelligence work. There's no wrong setting for it, but you have to be set within yourself and be open and curious about that work in order for it to happen. Can you aid the process of self-awareness that comes from emotional intelligence work? Yes. Are there models for that are better than others? Yes. Are there spaces for that are better than others? Definitely. But is one more appropriate for you than another? Sounds like you got to figure that on your own by doing your own inner work and start asking yourself real hard questions. Like one of my favorite examples of this is like, we actually researched this. You can put people who are anxious or depressed into what they call green spaces and blue spaces regularly, and their anxiety and their depression will dissipate. It will go down. Diminish, I should say, not dissipate completely. But what that means is green spaces would be the mountains. Greens, lots of greens. There's something about green stuff that my body just likes, and my anxiety and my depression settles. I do that regularly. I just got to be there. I don't have to do anything. I just got to be there. I settle. Blue spaces, ocean, right? Get into the ocean, get near water. If I'm there regularly, frequently, right? Go fishing, man. Maybe not with my kids because I never actually get to fish because I'm always changing the fishing poles. But like you go fishing, it's a peaceful, beautiful, wonderful thing. And you just feel this energy different within yourself. But the more aware you are of that, the better you are at being, quote unquote, emotionally intelligent.
Interesting.
And so that emotional awareness, that emotional intelligence can be aided by experts. And those experts are, who knows who they are. Some of them are licensed therapists. Some licensed therapists are not experts in this particular arena. Some of them might be, gurus. Some of them might be docs. Some of them might be, who knows, professors, right? I've had teachers who were emotionally aware of stuff that I never even knew. And they influenced me more than anybody I've ever met in my life. These are elementary school teachers helping these kids out. And I just think that we as human beings want to put so many conditions on our healing. And I don't know if that's just a subconscious defense mechanism to change. Because we're so afraid of change. And this heart work stuff, it changes you. And that process requires you to feel some stuff. And the stuff that you're going to feel is going to feel really crappy. It's uncomfortable. It has to. That's the point.
I love what you said. And it reminds me of a couple things. I went to, one thing is as doctors, we go to these continuing medical education courses, and as therapists, you all do too. Yeah. And I actually taught at one of those. It was on sleep, actually. It was nice. Fun. We'll talk about that.
That's awesome.
But it reminded me of a medical conference that I went to on more like holistic healing and stuff. And one of the things that the guy taught about was nature medicine. And he showed these slides and he showed all this data, right? It's actually something that's being studied now.
And it really is, which is weird.
I grew up so rural. Like I would literally go out my backyard, jump on a four-wheeler, ride for a few miles, and I was up in the mountains next to a stream, sleeping in a sleeping bag. And that was like the way I grew up. And being connected to earth and trees and water, and that was all just very normal. That was my thing. I had walked on a dirt road to get to the bus, like, and there's a practice called Shinrin-yoku, like the Japanese do this. And it reminded me because they have blue zones and green zones, and it is called forest bathing. That's the direct translation. And Shinrin-yoku, the Japanese have been doing it for a long, long time. And they go into the forest and literally just breathe and smell and hear and see and touch. And I don't know if they taste things in there too, but use their senses and just ground it down into the earth, and how powerful that is on someone's physiology. So nature medicine showed like decreased strokes, decreased heart attacks, decreased anxiety, decreased depression. So
it's wild.
So the connection between our emotional intelligence and our physiology is profound. And a lot of it probably has to do with sleep, honestly, because our cortisol levels are better and everything's better. And so we have less heart attacks, less strokes, and all those things as we spend time in nature, immersing ourselves. One of my hobbies is foraging. A lot of my clients know I love to forage for mushrooms. And right now, actually, I'm going this weekend, and I go just about every weekend right now.
Where do you go to forage?
All the high mountains right now are awesome.
Really?
Yeah.
Very cool.
Yeah, super good. And it's very cathartic for me. And
I've always wanted to do that.
It's almost EMDR-ish, because you're literally looking side to side as you're foraging. And every once in a while, you get a smell that's like incredible. It's like the best, like pine with dirt, with mushroom, with like clean air and happiness. It's just like this beautiful, and it just hits your mind, and it's grounding, and it's therapeutic. And I'm like, come on, let's go up there. Let's go check this out. And my kids think I'm crazy, but I'm always trying to pull them up there with me. And I get them every once in a while, but it's just so cool that there's some of your understanding in that space is consistent with mine too, where mental wellness as well as physical wellness, as we find a connection to nature, to green zones, blue zones, how cool that is. That's
you can't separate physical and mental wellness. I mean, they beget one another, you know?
Mm-hmm.
Yeah, that's really cool. And foraging, I've always wanted to do that. I've seen people do it and go mushroom hunting and stuff.
Oh, we'll
that's
go.
Really cool. I would love to go.
Yeah.
Yes, I would love to. Yeah.
If you're having a conversation with a spouse or a loved one, wait, before I go there, what we just talked about was really profound, and I want to just hit on a couple things. One of them is an emotionally vulnerable conversation, whether it's with a therapist who can professionally guide you, or with a friend, or with a parent or a sibling, or any of that is really, really powerful. And again, I think it speaks to the community. The we is greater than me. And I've had some of the most profound emotional discussions with friends. Like you just get past the surface and you go there, and there's an openness and there's a connection, and you're learning and growing in that moment as you're just sharing and they're sharing, and there's no judgment. There's just, it's kind of love, right? It's just connection, and it's really cool. And anyway, I think that's really cool that we can continue to grow emotionally throughout our lives in multiple pathways. Therapists obviously can guide and direct us, especially with some heavier stuff, right? Maybe we got to handle some emotions we're not comfortable, I think, with a friend. But that's really, really cool. If you are in a conversation and you find it becoming too ruminating, right? It's too frontal cortexy. It's way too cerebral. I guess my question is like, how do you get past that space and emotionally connect to a spouse, to a kid, to a child, a son, a daughter, a friend? Like I think we all, in passing, we have these pretty superficial relationships. And I guess what I'm asking is like, how do we get past all the frontal cortexy? Hey, how was your day? It was good, man. I went to work, I came home, and it just going through like just brain stuff and get into some more deeper, better connecting space.
I guess it depends on who it's with, but I'm always a big fan of hugs.
Yeah, cool.
Get into the body. There's a whole lot that can be said with an embrace or with a look that means so much more than any words could ever convey. And I really think that there's value in getting back into your body. Eckhart Tolle, Power of Now.
Yep.
Mind blowing, right? I was just like revolutionary. That whole book is about getting out of your head and into your body. And that's the gateway to being in the present moment, which is where everything happens. Like nothing ever happens any other time than now. Like there's no other thing actually in the world besides now. Like this is it. You're in this thing called now. What are you going to do with it? And when we end up in these really, cognitively driven, intellectual type conversations, it's easy to get lost in them. That's why I think the connection that we have to the body always seems to come through the breath. And the more time and experience and practice we have working with the breath and moving back into the body through the breath with practices like just mindfulness awareness practice or like even deep breathing meditations or breath work. It wouldn't be a podcast with me if I didn't mention how much I love going in cold exposure. I'm obsessed with cold exposure. Cool. And I talk about it all the time. It's changed my life. It's become this mantra that I bear with people where I'm constantly, every time I speak anywhere, I'm like, check this out. Let me show you some cool research on the cold, because it's getting you out of your comfort zone and you're in the body. Like no matter what, you get in cold ass water. We're talking like 50s, 40s. Your head isn't doing anything. It's yelling at you to get out, but you have to tell that part of you, that head, you have to tell it stop, and you just breathe and you sit there. And the entire time your head is wanting you to get out, but it's not doing anything because you're in charge. And there's a practice to this, right? Yeah. There's a practice to being in charge of your head. And that comes through heart work. And the gateway to the heart is through the body.
Yeah, cool. Hugging and cold therapy.
Let's go. Cold therapy. Okay. Breath.
Yeah.
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 Feeling, awareness, mindfulness, all that stuff is so powerful.
Maybe to get out of that headspace, just stop talking. Stop talking. And just touch, connect.
I can't tell you. I'm a big fan of like the Stoic philosophy, and you read any Stoic anything, and they're basically just saying, stop talking, just listen, just be. Actions speak way louder than words. We talk so much, and so be the guy in the room or the gal in the room that listens, and when you speak, your words mean a lot more.
Nonverbal ways of connecting, and it's not all sex, right? Like even just touching a hand or putting an arm around somebody, or even just a posture, where there's a lot of really cool nonverbals. Really sweet. That's great. Those are good points. Thank you so much. I want to, we don't have a ton of time left, but I really want to get into your specialty, the trauma space. We talked a little bit about it before. I want to talk about modalities that work that you found that are really helpful. What your maybe what your recommendations are. Maybe folks, as a family doctor, I deal with a lot of psych stuff and a lot of trauma, and it's heartbreaking, the stuff that I hear. And people trust me. They just come into the room, they're like, oh, you're a doctor, I can tell you everything. And I'm like, okay, oh boy. Yeah, and they unload some stuff, and I'm like, holy cow, that's like horror movie times 10. Like it's really, really bad stuff. And I hear them and I listen to them, and I want to help them through those journeys. We've started ketamine therapy at the Voyage Clinics as a part of that equation, always in conjunction with a good therapist, a good trauma therapist. So I'd love to hear kind of your insights on trauma, maybe some ketamine stuff, and then how that might make therapy more effective.
Sure.
And what therapies are effective in trauma. Go ahead.
I mentioned before internal family systems, which
can we define trauma? Can we just talk about it? Like
trauma,
lots of different kinds of trauma.
Oh yeah, let's define trauma. So my favorite definition for trauma comes from Bessel van der Kolk, wrote Body Keeps the Score. You want to learn about trauma? Read that book. Yeah, everybody needs to read it. Yep, and that's a literal everybody. It's difficult to get through because it's kind of heady. It's kind of academic, I guess. It's a little dense, but it's worth piling through and looking up definitions, etc. His definition for trauma is an event that overwhelms the central nervous system, altering the way we process and recall memories. And then I add on to that, reducing our capacity for adaptation.
Okay.
There's a lot there.
There's a lot there.
But it's an event that occurs, and this event changes the way your nervous system functions permanently.
Yeah.
And people don't like to hear that word permanently, but that's the nature of things. Like, sorry, all changes are actually kind of permanent. Like you can't change them and they last forever.
We call it autonomic dysregulation. I saw a gal today in my office. She had goosebumps 5 times during our visit. And she has trauma in her past, and she has anxiety, and she has these things. And I could literally feel it coming off of her. And I sent her to a person like you. And I said, we need to work through some of this stuff because we need to recalibrate that autonomic nervous system. You're way too sympathetic nervous system centric, and we need to just recalibrate. So I'm sorry, keep going.
No, that's great. It's because that's what it is. It's all the nervous system. It's the brain is the powerhouse that controls your nervous system, and the brain is altered forever by this one event or series of events, or the complexity of an event and in relation to the severity of the event, which it's such a broad definition, but I like it because it's accurate. And I also like it because it rules out all of the stuff that really isn't traumatic that gets used nowadays as like this colloquialism, it's my PTSD, right? Well, to be clear, it's not your PTSD. It's a trauma-induced response or a response that's due to your experience. And those responses due to your experience are run by the subconscious part of your brain. And it runs the show of your life. I mean, a lot of research on subconscious brain says that the subconscious part of your brain is running 95% of your daily activity, autonomic, arousal, et cetera, et cetera, et cetera. I mean, that's huge. It's a lot of stuff going on upstairs that you're not even aware of. It's just happening. And that's all created by your experiences.
Psychological trauma, emotional trauma, sexual trauma, physical trauma, financial or starvation trauma. I mean, you mentioned some of those spaces.
Spiritual trauma.
1000%. So those are all like, I don't know if we could categorize them. Like because I think a lot of people think trauma, they think like I got in a really bad car accident and I severed a limb and I saw a lot of blood. But it can be all those other categories because they recalibrate the brain and we now think differently, Correct. We act differently, and we tend to be more anxious, more sympathetic nervous system driven, like fight or flighty, right? So, So how do we fix it? How do we address it? How do we look at it? How do we recalibrate to recalibrate that autonomic dysregulation? Like how do we?
You have to re-experience that autonomic dysregulation in some sort of controlled setting and reassign cognition to those sensations. Simply put, you got to feel the pain that you went through to some degree, and you have to understand what that makes you think about yourself or how that makes you see yourself and change that. There's 5 core themes of trauma. According to cognitive processing therapy, this is that model. And they are safety, trust, power and control, esteem, and intimacy. When you go through a traumatic event, one of those 5 or a combination of those 5 or all 5 of those things, the way that you saw them before that event is now different after that event. And you believe I'm no longer safe. I can't trust myself. I can't trust others. I'm powerless. I'm out of control. I have no control. Or a lot of times it's my fault. It's my responsibility, right? I'm worthless or I'm unlovable. And those things start to become, they run the software of your mind. And if you continue to believe that, for example, I'm unsafe and I'll never be safe again, that's going to affect the way that you behave, and you're going to become reclusive, or you might become, so introverted and isolated from the world that you now no longer have connections, and you become really, really deeply lonely, and then you become hopeless. And that hopelessness eventually will lead to some sort of thinking about you probably maybe not wanting to be here. And that's just kind of the trajectory of these things, right? Yeah. And that all started because you began to believe that the world wasn't safe, which is not true. It's only half true. The world is not safe, and it's also safe. It's both. And that's the DBT, dialectic concept. And you learn that as you begin to re-examine these events of your life, these traumatic moments, where you began to first believe that you were at fault, or you began to first believe that you could never be safe again, or you began to believe that you were worthless. And you begin to look at these events, the series of events, the one event, and you begin to understand, like, oh, the way that I've perceived this thing in relation to myself is wrong. And I have control over that. And so I'm going to change the way I perceive myself in relation to now, not then. What do I know now that I didn't know then? It's probably the question I ask the most in therapy. What do I know now that I didn't know then? And you can really begin to shift the way the brain functions, the way the software runs in the mind, and change how you see yourself, how you see the world, and how you see others. And become safe again, trust again, feel in control again, feel powerful again.
Is there a real-time way of thinking that is maybe preventative toward trauma?
Yes. This is a really brutal one, because this comes up a lot. I do a lot of group therapy. It's actually probably, of all my favorite models and modalities, group therapy would probably be number one. I just love it. I think it's really dynamic. And what you end up getting in group therapy is you really get a bunch of people in a room who have to embrace this idea that we are actually powerless, that we can't control like anything. And so believing that this thing that happened to you is your fault is the problem. It's not that it was your fault.
It's believing that it was.
It's believing that it was my fault. And that's my attempt to try and feel powerful in that situation. I was actually powerless and I couldn't do anything. And I blame myself for something that I could do nothing about. It makes sense as a child. It's like a great example of this is a kid whose parents get divorced. What does a child do? How does a child think about that? Yeah. I had something to do with this. This is my fault in some way. Never true. But that's the child's attempt to find some semblance of control in a situation where they had none.
They can't control it.
And with sexual abuse, this is extremely common. Physical abuse, extremely common. Spiritual abuse, this is like the coup de grace of spiritual abuse, where it's all my fault and I'm a sinner and I'm bad. And because I'm bad, all this stuff is happening to me.
Ugh.
Yeah, brutal. I don't do a lot with spiritual trauma anymore. I did for a long time, but I've kind of moved away from that just by happenstance. But it's a big deal.
It's a big deal.
It is. So
in real time, creating a resiliency or a resilience toward trauma would be maybe like letting go,
accepting powerlessness,
accept that you can't control,
and you can control a couple of things.
Yeah,
your breathing, step one.
Yeah,
and that's why it's so powerful to work with the breath, because you can control your breathing at all times. If you're in a panic attack, the first thing that you do, if you're in a moment of trauma response, right? I call them emotional flashbacks. The first thing you need to do is go, I need to take a breath.
Because you can control that.
Because you can control that. And then the brain goes, okay, we have a little bit of power over this. Okay, what can we do next? And it just creates this little tiny sliver, this little baby hope thing. And now maybe we can do something about it. If I just breathe through this, I can make it. And I'll roll this into ketamine because I know we're short on time. That's exactly what you do in ketamine, because it's at times very disorienting, and you literally have to surrender to this thing that's creating this dissociative experience that you are powerless to. You can't do anything about it.
Yeah.
What can you do? Accept it. Breathe. And a lot of times the feelings that show up during the psychedelic assisted therapy experience whether that's with ketamine or any of the other ones,
Sure.
right? Is this intense feeling that reminds you of that moment and might even be accompanied by visuals or sights or sounds or smells that you associate with those traumatic moments.
Yeah.
And it aids in the surrender process.
Creating vulnerability, creating space to be curious about changing.
There's that word again.
That's beautiful.
Open to it. Open to the fact that I can't do anything, and that's okay.
I love ketamine in a couple of ways. One is it just gets rid of the ego. It gets rid of the sense of guilt and shame and fear, because yourself is now gone. It's in a tapestry of colors and all kinds of awesomeness. And I often see my clients giggle, smile, laugh, because all of that ant thinking space is now gone. And around trauma, that's super, super. All the control is now gone, because you don't have control, because you're not even there anymore. And it creates an experience where post facto or after the fact, they can just say, that was kind of neat. Not to mention the physiologic response that's beautifully evidence-based, that creates a brain-derived neurotrophic factor spike that creates neuroplasticity. And it's amazing.
It's incredible stuff. Oh, yeah.
So I'm a big fan. I think it's wonderful. And it opens doors, creates vulnerability, and getting therapy done. Have you found people to be a lot more receptive to therapy, a lot more productive in therapy after ketamine treatment?
Oh, yeah. I've had tons. And I've been trying to open a ketamine clinic for like the last year and a half, but we keep running into barrier after barrier. Yeah. Someday we'll get it open. Yeah. But I love it. And I love psychedelic assisted anything stuff. I've been in different states and done work with that in the different arenas now that are available. And I have never been more excited about the potential to do good for mental health.
Yeah. Yeah. It's incredible.
It really is. There's a lot of amazing things happening right now. And I mental health, I'm going to take out mental and just say health in general.
Totally.
Because we are in a space right now where we can really do some great work and get people healthy when we're at our sickest. So, culturally, societally.
A lot of our youth, I have several teenagers and a couple early 20 kiddos and one early 20 kiddo. And I think there's some mental fragility there, and there's some shaping of the mind, the coddling of the American mind, right? This book is
yes,
good.
I just read that. My mom gave it to me.
Yeah, it's
so
good.
Wild.
And I think we have to be really careful there. And I wonder, how do we help the next generation be more resilient toward trauma? A ton of them are undergoing autonomic dysregulation. They call it anxiety. It's autonomic dysregulation because the way that you're processing is pro-trauma processing. And it's creating these really scary things that you feel like you have to control and that you should control, but you can't. And then it's exactly what you just described and talked about. I think our youth are becoming psychologically traumatized from a lot of the social media stuff, from a lot of the ongoings. And so one of the things we talk about during all the well child visits, all their sports physicals, we hey man, screens, what are we doing there? And emotional intelligence work, are we okay? And a lot of them are no, I have really bad anxiety. And I'm okay, well, then it's tough because I think a lot of it is emotional trauma. And so
does that correlate to screen time stuff? Are you recognizing?
Yeah,
I've seen that too.
For sure.
The screens
There's
thing.
never been a more challenging time to be a teenager than right now. The obstacles in place, the diabolical influencers out there that are influencing the minds of our young ones is really, really tough. And teaching them this is this and that is that, and none of that's real. It's just really tough. So I think that's a whole nother podcast, but
it is. But, well, and I like to, I just go play again, right? These kids, man, they just need to play. Totally. They need to go do sports. They need to go get into nature. They need to go freaking hunting and fishing. And if you're in this area, right? Yeah, whole other podcast. But it's such a valuable thing because it's, Dr. Nadine Burke is this incredible researcher who works on trauma. And she says, today's anxiety and depression is tomorrow's heart disease.
Totally.
Which is
100%.
Right?
Yeah.
And so it's just your body's kind of cluing you in here. It's like saying, hey, buddy, wake up. You're anxious not because there's something wrong. You're anxious because you need to change something. This is not the state we're supposed to be in. This is uncomfortable for a reason. Don't numb this. Do something about it.
Yeah.
And that's hard. That's a challenge right now because we have so many avenues for disconnection and numbing. More than we ever have. Especially when it's at your fingertips all day long every day.
Totally.
It's
totally.
tough.
Escapism. Matt, thank you for today.
You're
this
welcome.
has been so fun. Let's do
likewise.
this again.
Yes.
There's like 3 more podcasts that we could
sure.
talk about easily on my channel, your channel.
Yes.
Really appreciate your expertise. Really appreciate your time and just teaching us a lot about emotional connecting and then modalities for therapy, how to make therapy and emotional intelligence work more effective. I appreciate you. To our listeners, thank you for tuning in, and please like and subscribe, and keep on sharing the goodness. It's good.